If you suffer an ACL injury, do you actually need to have surgery? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on all sorts of sports and exercise injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. I've talked recently about why an ACL is such a big deal. I talked about what it is, how you tear it, and why it's a problem. I explained how the pain and the swelling and the motion of your knee very often gets back to normal, but the challenge is that your knee can be unstable or give way. Now let's talk about what you do about it. I mentioned how a lot of times, most of the time, all the time, it's very rare that an ACL injury would heal on its own, that the ligament actually heals back together. This is sort of like a rope that breaks, and all those the ends are just frayed, and they just don't heal back together. The joint fluid washes away the healing cells, and it just doesn't work. So very often we talk about surgery, again, because the knee can be unstable after the injury. Now that's not to say that everybody needs to have surgery. So let me explain who might be in the group of people that doesn't need it. Well, first of all, people that aren't terribly active. They're either sedentary or they don't do that much in the way of sports or exercise. They may not need surgery. They may not do a sport that involves landing from a jump or running and planting their foot to change directions, cutting and pivoting sports that involve twisting on the knee. And if they're not doing those activities, they may not have their knee give way, because a lot of times just walking straight ahead doesn't give people too many problems. The knee doesn't give way with that. It's with landing and trying to stabilize the knee when you land from a jump or changing directions, cutting, pivoting. So if you're not doing that, you might not necessarily need to have surgery. So sedentary people, maybe older, more sedentary people, might not need to have it. Now, you may do a sport that you really like doing, but it doesn't involve those activities. I hear occasionally people tell me they just like to jog and lift weights, and they can do all of that and their knee doesn't give out, and you may be perfectly fine to avoid having surgery. And there is a subgroup of younger active people. Some people call them Acl Copers, or the Copers is the term typically used, where for whatever reason, either they get their muscle strength better, back better, or they get their balance and that type of thing better, but they don't have their knee give way with those activities. And if that's the case and you're not having your knee buckle on you and give out with those maneuvers, you might not need to have surgery. So what would you do if you didn't have surgery? Well, there are braces that can help stabilize your knee for physical activities. They're not perfect and they don't prevent your knee giving way every time, but that can be helpful. Sometimes working with a physical therapist on getting the strength of the muscles around your knee and around your hip, that potentially could be helpful. But at the end of the day, a lot of people, despite physical therapy, even despite a brace, still feel that their knee's unstable and they can't do what they want to do. I had a guy in my office just the other day. He had been having an unstable knee since an injury, I think it was like 23 years earlier. And he was just like, I don't know what happened, why my knee feels like this, but it just doesn't feel right. And he had been basically living on a chronic ACL deficient knee for 23 years. And what got him was that it was just giving way when he wanted to do activities. So very, very often in people that have their knee giving way, we'll talk about surgery. And that's for two reasons that we'll talk about in the next video. One, they can't do what they want to do. And two, there's a risk, as long as your knee keeps giving way, that you could do more harm to it. Okay, have you suffered an ACL injury, and did you avoid surgery or want to avoid surgery? I'd love to hear your experience, and I know readers all over the world, viewers all over the world, would love to hear your experience as well. So below this video, share your comments, share your experience. Like I said, I'd love to read it, and I know there'd be tons of value for everybody else watching. If you know somebody dealing with an ACL tear, please share this video with him or with her so that hopefully they can learn a little bit more about this really difficult injury as well. If you like more information like this on sports and exercise injuries and surgeries, subscribe to my YouTube channel. There's a subscribe button in the upper right corner of this page. Click on it. I record a couple of these videos every single week and they'll get delivered directly to you. Thank you so much for watching. I hope this video was helpful and I look forward to seeing you right here next time.